Back, it is summer and people are showing more skin, and tattoos have become a popular trend. Over 45 million people have them in the U.S., but 1 in 5 want them removed. So joining me today is Dr. Kyle Coleman from the Westlake Dermatology Center, which is the first in Texas to offer Pico-Sure, which is a new laser treatment procedure. Dr. Coleman, thanks for being here today.
Thank you very much. Thanks for having me.
Talk about Pico-Sure and the process that it uses to remove a tattoo.
So like you said, we're the first in Texas to have this new device. It's really a revolutionary device in tattoos. For the longest time, these lasers have been sort of redundant and that they caused a lot of pain, needed multiple treatments to treat the area.
Right.
The Pico-Sure is unique in that the laser energy is delivered more quickly, so you get less treatments, less pain, and more efficient removal of blacks and blues and darker colors.
Less treatment. How many treatments are we talking?
So before we were talking about 10 to 20. Now we're maybe talking 4 to 6, and so big difference in the cost and the time.
What is the process it uses to? Does it remove the ink? Does it erase the ink? How does it get rid of the tattoo?
So how tattoo lasers work is what they do is deliver heat to the ink, which makes it into smaller particles that the body can naturally just take away and move away from the skin, so that there's no longer ink present in the skin.
So when someone comes into your office, they say they want to get a tattoo removed, what do you recommend? What's the consultation like?
So generally we look at the size of the tattoo, the colors in the tattoo. Generally blacks, blues, greens go away very quickly. Reds and yellows tend to take a few more treatments. So the larger the tattoo, the more likely they'll need more treatments. But in general, we start with about 4 treatments and then reevaluate after that.
You said the pain is less. How do you describe it to patients?
So in general, I think it feels like a rubber band being fired. It's a little bit of heat, but we have cold air blowing on the patient as we do it, and we also ice during the treatment, which helps reduce some of that discomfort.
Is the Pico-Sure specifically for tattoo removal, or is it other?
Specifically made for tattoos. There are only about 15 of them in the world at this moment, and so it's only for tattoos at this moment. They're looking into other avenues that it might be used, but right now just tattoos.
This time of year, as a dermatologist, what other conditions do you typically treat?
So this time of year, we're also looking at a lot of things. People, like you said, are showing more skin, so cellulite, melasma, pigmentation, all those normal things, and so we're seeing a lot of consultations for pre-beach time.
Absolutely. Dr. Coleman from Westlake Dermatology, thanks again for
having
being
me
with us today.